is going live
Yeah.
and we are live. So, good evening, everyone. This is Batul from IGCP, the moderator for today's session, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, sir needs no introduction at our platform, but yet it's our great pleasure and honor to introduce him. He is none other than the very renowned super specialist in sexologist and infertility, Dr. C. Sharat Kumar, sir. Sir is MBBS, MS from UK, DRCOG from UK, PhD in super specialist in sexology and infertility, Dr. Sharat's Men's Clinic, and director at Mediwave Fertility Research Hospital. With such wonderful insights, we are going to talk about the topic for addressing age related changes in sexual functions and libido. As individuals age, changes in sexual function and libido are common but often overlooked or misunderstood. This webinar aims to provide healthcare professionals with insights into the physical, psychological, and emotional factors that impact sexual health in aging individuals, along with strategies for managing these changes effectively. We'll be learning more about the complexities of sexual health in aging individuals and learn practical approaches to supporting sexual wellness across the lifespan. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. Sir, over to you.
Uh, Thank you very much, Batul. Good evening, all my esteemed colleagues. This evening, I am going to talk on age-related sexual function and libido. So that is the topic of the day, and I'm going to cover this under these chapters: introduction, life after 50, body changes, risk factors, sex health issues, tips for improving that is one, and preventive measures and carry home message. So these are the chapters I'm going to cover. Sexual changes in aging are a normal part of our development process influenced by several factors. Understanding these changes is critical to promoting sexual being in an aged population. Some changes in our sexuality as we age might enhance our sex life. Aging is associated with variety of changes: physiological change, psychological change, social change. All these affect an individual's sex health also and sexual health being also. As you know, the world population is increasing. The longevity, which was 32 in 1947 of India, today it is 72. That is, you as you go across the road, you start meeting more and more and more aged people. In fact, in countries like Japan, there are more aged person than the young people. That's because of the increased health aspects and increased better quality of life, better quality of food. The longevity of the people has increased. According to WHO, number of people in the world over the age of 60 will be double in the next 30 years. That means the whole world will be full of the aged people. And with advances in medical technology and general biosocial information, people are living longer, but that doesn't mean we are living better. Just because people are getting aged, that means they're all well settled up or having good health. Aging and sexual functioning and satisfaction. The aging process has a tremendous impact on sexual functioning and satisfaction. As we age, we tend to have more medical issues, and many medications can impact sexual function. As we age, we often experience changes in our sexual behavior, desire, what we find arousing, and overall sexual well being. So, as the age advances, sexuality generally decreases. This is a universal phenomenon. There may be sexual activity, but that will be reduced in quantity and quality. In women, when women reach middle age, they experience menopause. This happens because the body stops producing estrogen. That will lead to vaginal dryness, decreased lubrication, loss of elasticity in the vaginal tissue. That leads to discomfort and even pain during intercourse. So she starts avoiding the intercourse. In some women, there may be decrease in nipple and clitoral sensitivity. All this ultimately lead to the discomfort and even pain during intercourse, so that she doesn't want to have the intercourse. In men, it is a gradual process. In women, it is sudden process, that is menopause. But in men, it is a gradual process that is called as andropause. Physicians should be able to distinguish between typical age-related decline in the hormone level and pathological condition, which is known as hypogonadism. So one should differentiate whether the person has got hypogonadism or age-related andropause. Many products and strategies are marketed to help older adults feel more vital and younger, but there really isn't much discussion about how to achieve health aging. Sexuality is a fundamental aspect of human life that we also don't talk about enough, and it undergoes significant changes as we age. Recognizing and addressing these factors is critical to promoting sexual health well-being and healthy sexual expression throughout the life. Another area of biological changes has to be to do with changes in the genitals themselves. Many men may experience decrease in the frequency and firmness of their erection, as well as longer time between the erections. That is, refractory period between the two when the erections is increased. It is important to note that while changes in the sexual function with age are normal, problems are not. While it is typical to require more or different stimulation to get an erection, these erections may be less frequent and less firm. Erectile dysfunction is not considered a normal aspect of aging. So, in younger age, even the view of a nude girl or just seeing a single X or double X video, the men will get erection. In middle age, that may not be enough. Even viewing the triple X blue film may not give adequate erection. In aged people, after say age of 60 or 70, even touching a woman may not give adequate stimulation for the erection. So as the age advances, the whatever these panchendriyas, touch sensation, the smell sensation, the hearing, and other genital sensations, even when they are present in the complete aspect, that may not give adequate erection. So this is just a statistical picture showing the proportion of as the age advances. That is EHS is the erectile hardness index. That is EHS one is very low strength. EHS two is slightly the strength is there. EHS three is medium strength is there. Erectile hardness score, that is EHS, that is 4 means best erection is there. So as you can see, the best erection is achieved at the age of 20 to 29. As the age advances, this erection, that is erectile hardness score, decreases as the age increases. At 70, hardly 11% have got good erection, and 25% of medium erection, and 32% have got low erection, and 30% have don't have erection. That is, erectile hardness score is 1 only. So as the age advances, erectile tissues calm down. And as the age advances, there is high blood pressure, diabetes will may be there, high cholesterol may be there, the person may be smoking, obesity, physical inactivity, all lead to arterial constriction, which will lead to erectile dysfunction. And hormonal changes. Hormones also decrease as the age advances. Testosterone decreases, and all other hormones decrease. That is positive hormones like free testosterone, they decrease. But the hormones which are not required, like FSH, increase. And how they respond related to the sexual desire. As the age advances, their desire also decreases. For example, 50 to 53 to 59, the desire is very good. But 60 to 69, desire comes down. At 80 to 90, hardly there is any desire. So erectile hardness score also decreases, and also desire also decreases. This is the rough approximate hardness index. In the EHS1, that is erectile hardness score 1 means it is there is hardly any hardness, just like a balloon without the tip being covered, that is open balloon. Hardness 2 means like a banana. If you press a ripe banana, you see the hardness that is equivalent to hardness score 2. 3 means rigid hardness is there. That just like a banana that is not fully ripe, just banana. And 4 is just like a cucumber. It is quite hard. You cannot compress it. That is hardness score. So what happens after 50? Hormones decrease, obesity will be there, sleep decreases, irritability increases, anxiety increases, loss of libido, and loss of motivation. So this lecture is for appreciate the impact of aging on sexuality and understand the normal changes in sexual functioning with age, demonstrate the knowledge of interplay between physical health and sexual function, and consider how mental illness can affect sexuality. Understand sexual disinhibition in dementia and approaches to the managing these. Sexuality in old age encompasses more than sexual activity. WHO has attempted to define sexuality as involving sex, gender identities, roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. Discussing sexuality in older adults is often thought of as a taboo even today. When an elderly couple come, many doctors are uncomfortable asking them about their sexual history. The first question when an elderly person comes to any doctor, the first question they ask is, do you have BP? Do you have sugar? Do you have thyroid hormone? Do you have arthritis? Do you have joint pain? But hardly any doctor asks whether sexually are you active or sexually whether you are happy, do you have a sexual partner, how frequently you have intercourse. So none of these questions are asked to for an elderly couple because we take it for granted that the sex is only for the young people, not for the aged people. This has led to stigma attached to this topic, which in turn can be internalized by older adults. Sexuality is even more difficult to study in older adults who identify as lesbians, gay, bisexual, transgender, or queer questioning, that is LGBTQ population, as the available studies often have a bias towards hetero communities and sexual behavior. A large study has been done on these elder people that shows a trend of increased sexual satisfaction, less sexual dysfunction, and more positive attitude to sexuality in later birth controls in comparison to earlier birth controls. When thinking of adult, there are many preconceptions and stereotypes that persist. There is still often a started belief that older adults do not enjoy or want sexual activity. Studies in this area suggest that 62% of men, 30% of women between the age of 80 to 102 have still sexual activity. So, sex is there, but we are not exploring it. There is much known about physiological changes in male and female sexual function as the body ages, and sometimes these changes can contribute to sexual dysfunction. In women, after the menopause, it is known as that vaginal lubrication reduces, vaginal epithelium thins out. This can lead to dyspareunia. These changes appear to be related to reduced level of estrogen and leading to vulvovaginal atrophy. Owing to chronic and progressive nature of vulvovaginal atrophy, it is recommended that early recognition and treatment provide the best symptomatic relief and reduction in dyspareunia and sexual dysfunction. First line treatment is usually local estrogen therapy and sometimes systemic hormone therapy. Other options include vaginal lubricants and pelvic floor training. Pelvic organ prolapse can occur in older women and adversely affect their sexual function. Successful pelvic organ prolapse surgery can lead to significant improving in the sexual satisfaction. So, two main changes in sexual function with age in men are ED, that is erectile dysfunction, that is and ejaculatory dysfunction. It has been suggested that ED occurs in about 50% of men over the age of 50 and is mediated by psychological and physiological factors. The most important risk factors include age, obesity, smoking, coronary heart disease, and depression. The most common treatment for these disorders are lifestyle changes to reduce the vascular risk factors, stop smoking, lose weight, and oral vasodilating phosphodiesterase type 5 inhibitors, that is PDE type 5 inhibitors, which act on to increase the blood flow to the penis. So newer techniques are also available, that is intravenous injections of prostaglandin E1 and penile implant surgeries are also available. Even more novel treatment being explored is intensity extracorporeal shockwave therapy. There is low energy shockwave therapy, which acts by promoting neovascularization. ED has reduced in recent years thanks to development of effective treatment, and clinicians are seeking an increased ejaculatory dysfunction. It has been suggested that improved ability to achieve an erection does not necessarily translate into ability to enjoy the sex. So, friends, that's all about the sexuality of aged persons. But sexuality is not the only thing which contributes for the sexual activity. Other changes, natural changes which occur as the age advances, also play an important role in sex and sexuality. So natural changes like skin changes, loss of muscle and physical strength, loss of teeth, loss of hearing, and altered sleep pattern, low energy level, decreased appetite, and loss of the skin, loss of elasticity of the skin, easily bruising, decrease in production of natural oils of the skin, and wrinkles, baldness, gray hair, some of loss of sight, age spots, growth, some growth that on the skin called as skin tags. So all these contribute for the last body dysmorphic disorder. That is, the attractiveness of the body is lost. Thereby, that stimulation, that desire is lost. So when the partner is aged, you will not get a desire because of all these body changes which occurs due to aging. As the age advances, muscle is lost, bones become thin, and body changes occur. That is because of the reduced testosterone. So reduces the testosterone begins to decline such that testosterone level begins to drop about 1 to 3% a year after the age of 40. That is after 40, every year there is decrease in the production of the testosterone. This natural decline, that is aging decline, however, does not imply that a man is testosterone deficient or a candidate for testosterone therapy. So, friends, now I will give tips for improving the sexual health of both men and women. These are all general situations where you can improve the sexual activity. The particular treatment depends upon whether to give sildenafil citrate or udinafil or tadalafil, that is particularly oriented towards the treatment of men, and in women estrogen, that's what I told earlier. The general tips are the food, fruits and vegetables, drink water, air, yoga, meditation, exercise, and mental health. So keep the brain active, train the brain, have good posture, start workout program, stop smoking, stop tobacco, stop drugs, stop or restrict the alcohol, monitor the BP, lose the weight if you are obese, gain the weight if you are very thin, and have good sleep pattern. And healthy food for the aged are fruits, vegetables, whole grains, fat-free, low-fat milk. For non-vegetarians, seafood, lean meat, beans, nuts and seeds. Cut down on saturated fats. Eat less of salt. So go for ghee, green tea, raw honey, foods such as visible changes, they will have better changes for the skin. Choose food with little or no added sugar, no saturated fat, and low sodium. So to get enough protein throughout the day, maintain muscle, try adding seafood, dairy, fortified safe product along with beans, peas, lentils to your meal. So drinks, green tea, mint tea, black coffee, fat-free milk, soya milk, hot chocolate, orange or lemon juice without sugar, vegetable soup, tender coconut, natural water are good drinks. Fruits and vegetables, all fruits and vegetables are rich in vitamin C. Take them. And alcohol, restrict the alcohol. If you are not alcoholic, don't start the alcohol. If you are alcoholic, restrict the alcohol. Choosing the alcohol, red wine is the best alcohol. So beer is also very good for health, but all these things have to be taken in limited quantity. Fresh air, natural fresh air. Keep walking in the parks. Keep walking under the trees. You get lot of fresh air. Start gardening on the rooftop when the sunshine is not there. That is in the early morning or in the late evening, so that you get fresh air. Water is very very important. Keep yourself always hydrated. Drink lot of water. Drink water or food, juices or beverages, tender coconut or any other drink which contains like beer or wine which contains lot of water. Yoga is ideal for the persons who are aged. In fact, regardless of the age, you can do yoga. Yoga offers physical, sexual, reproductive, and mental health benefits for all the people of all the ages, including the aged people. Yoga does not have age limit, but certain yoga poses you may not be able to do after the age of say 60 or 70. The key is to stay away from poses that combine core strength and balancing, like headstand or Digasana or Shirsasana or some asanas where the Halasana, where you may have to you do lot of physical and require strength. So best yoga is simple yogas include restorative yoga. These are the simple. So always ask your yoga teacher to teach the yogas which are good for the aged person. Simple, effective. So don't strain yourselves. Pranayama, any age, any group, even an 102 years person can do pranayama. It doesn't require any strength. Some of the pranayamas like Nadi Shodhana pranayama and Ujjaini, Sheetkari pranayama, Sheetkali pranayama, Kapalbhati, Bastika, they are all extremely good for the health. So meditation for aged person is very very important. So it gives lot of mental improvement of the mental health. So increasing the mental health and physical health will lead to better sexual health. Weight management is very important. If you are obese, start losing the weight. If you are very thin built, start putting on the weight. So start doing dieting, exercise, keep an eye on your body mass index, and the golden rule for the weight loss still apply. So keep the perfect body mass index so that a person who is physically fit will be sexually fit. So simple exercises for the aged persons other than yoga is walking, exercise, cycling, swimming. These things can be done, jogging, dancing, but do not strain yourselves. So sexual activity for aged persons, unlike some myths, suggest sex isn't just for the young. Even senior citizens do have sexual activity. Even people who are above 80, even those people are sexually active. So they can enjoy the sexual activity with not only with a partner, they can also use other instruments and equipments like sex toys. So and also they can take the help of the medical personnel, take the PDE5 inhibitors or the vibrators or shock wave therapy or platelet rich plasma injection, or even they can go for penile implant surgeries. Sleep is very important. Sleep well so that once you sleep well, your sexual activity will be good. Any sleep disorder, always consult a sleep specialist or a psychiatrist. Try to get good sleep. So, walking about for 30 minutes to 1 hour before going to bed will give you a good sleep. Music therapy, listening to soft music like a piano or sitar or veena before sleeping will get a very good sleep. So, good sleep, morning erection will be extremely good. Mental health, always do pranayama, yoga, keep active with your own peer groups, you exchange your thoughts, laugh every day, meet them every day, stay connected, your mental health will be very good. So, keeping mental health, physical health in an excellent way will improve the sexual health. Weight management is very important. So, friends, as the age advances, sexuality decreases. That is a universal phenomenon. But now, since more and more people are getting aged, it is the time to look into the all the aspect of the geriatric population, including the sexual aspect. So don't ignore the sexual aspect, sexual aspect of the elderly citizens. When elderly citizens come to you, ask them whether they are sexually active and whether they want to be sexually active. Try to help them and see that you prescribe proper medicines to keep them sexually active. So, friends, thank you very much for listening to me. Sorry, my voice is not that good today because of I had little laryngitis. So, my voice is not that energetic as earlier, but I hope the message I wanted to convey has been conveyed. So, over to Batul for any questions regarding the topic which I have discussed today. Batul, are you there?
Yes,
Batul,
sir. Yes, sir.
are you
Thank you
there?
so
Yeah,
much,
yeah.
sir. Yes.
Yeah.
Thank you so much, sir. Thank
Yeah.
you for your overwhelming talk that you have shared on our platform and for making our viewers understand about the topic for such a better manner and for letting us know that how with age and the addressing of age related changes can definitely help in their daily life and their functions. Moving ahead with the question answers round, do we have any questions from the participants? If
Yeah,
yes,
give me.
kindly jot them down so that we can ask sir till the time he is here in the platform. Other than that, so we are getting a lot of feedbacks from our viewers saying that they need these kind of more contents from you to hear out on
Sure,
the
sure, sure.
upcoming days. So
Yeah.
that yeah, we are getting greetings from Dr. Aditya as well, and
Thank
he's
you.
also
Thank
letting
you.
us know that he wants such contents more in our
Yeah,
upcoming
in the next lecture, I'll give more specific treatment aspect for men and women differently. Because in 30 minutes, I may not be able to cover the entire topic. So what we'll do is, in the next topic, the management of sexual health in men. Or next one will be management of sexual health in women after 50 or after andropause, like that. So management of men after 50 or 60, or management of sexual health in women after the age of 45 or 50. That is once they reach the age of menopause and andropause, the management is entirely different than the management of the sexual health of the younger and middle-aged people, because the same tablet, say something like Viagra, which works excellently on a man of 32 years, will not work on a man of 62 years, because in 62 years man, the blood vessels are narrowed. We require something more treatment than the just PD5 inhibitors. Like that, in women, in the for age of 30, the treatment is just you give vitamins and minerals, she'll be sexually active. But when she reaches 52 after the menopause, we require estrogen gel to lubricate her vagina. So the treatment differs. So what we will do is we will take up two different topics. One, management of sexual health of men aged about say 50, and the management of sexual health of women aged above 45.
Thank you so much, sir. Thank you. Like we are getting responses from Dr. Aditya and from the others, they will be waiting for your future presentation, and of course, we will be also waiting eagerly for your future presentation. Thank you so much, everyone, for your ardent participation that we have
Thank
received
you.
today
Thank
while
you.
joining in. And of course, definitely, will become next time we will be coming up with something more interesting, like Sir said and Sir mentioned right now. So please stay tuned with us for further upcoming episodes. Till then, please take care of yourself and your surrounding. Thank you.
Thank you, Batul. Thank you. I sincerely thank the IJCP people, the mid talks people, the authorities for giving me an opportunity to address you. So it's one of the best platforms for exchanging our knowledge in the field of the medicine and surgery, especially the recent developments in the management of sexual health and reproductive health. Thank you. Good night.
Thank you so much,
Shubha.
sir. Thank you. Good night, sir.